Now, we'll talk about women for a minute, though I was making it clear in both these talks. I'm not really a fan of pitting the genders against each other in general or in this area when it comes to mental health, because in a country like ours, in a region like South Asia, men and women are both suffering when it comes to not just the conditions themselves, but the stigma, the shame, internalized shame, the lack of access to quality treatment. And of course, the list goes on. But if we speak about women for a moment, there was an article I'd done a while ago, which I'll also link here. And I'd spoken to clinical psychologist Kamna Chibber and senior psychiatrist Dr. Achal Bhagat for some of the insight into this. Mental health disorders, in fact, like anxiety and depression, we know tend to show up more in women. In fact, Amna Chibber saying statistically, women tend to have higher rates of depression, anxiety disorders, body dysmorphic disorder, and eating disorders. They're also affected by mental health concerns such as postpartum depression and premenstrual dysphoric disorder. And I think, it'd be helpful for you to think about layering onto that the lives and the conditions and the social determinants and the intersections we know that exist. And one of these is that we know that the majority of the burden of invisible labor is done by women. Keep that in mind. The majority of caregiving responsibilities, whether it's for aging parents, relatives, or children, is done by women. So keep that in mind, because there have been links, of course, to exhaustion, stress, and burnout. But I would say I did not know this before looking up the research for this, that caregiving has all the features of a chronic stress experience, according to an article that I'm going to link in there. So lots of different factors playing a role. And that might be surprising to some of you who think of mental illness more from the lens of chemical, biomedical, etc. So you will be hearing a lot of people using the phrase biopsychosocial to talk about mental health.